I wear a lot of hats. I do a little bit of everything. In 1993, I started it as a response to frustration, actually. As a school nurse, I came out of the hospital setting, came here, and I had all of these kids with ear infections, and their eardrums would rupture and it would impair their hearing. So we started in 93. We operated strictly as a school-based health center until 2007. 2007 we went with the nonprofit foundation, and we've been with the nonprofit foundation since. We started out in the first just offering medical services. It became real evident real quick when we started seeing people that we needed pharmacy, so we added the pharmacy first. Then we added the dental, because it was just amazing when you did well child physicals on kids, even kids that had Medicaid. They had horrible teeth because there was no place for them to go, even with their Medicaid, to get services. So we added the dental clinic. And then about 2 years later, I had a pediatrician that kept coming from, well, she'd originally moved from Austin. She moved to Lubbock, and she would come up here, and one day she came and she said, "You need some help. You need somebody to help with some of these kids' emotional problems." So she hooked me up with a mental health counselor, and we added the mental health. So it's been kind of a progressive thing. Last year here in our dental clinic, we had about 4,000 visits. So we saw about 800 to 900 individuals in our dental clinic. In our medical clinic, the numbers are real close to the same. So you're looking at a little bitty spot like this having about 8,000 medical visits of some kind in a year's time. And there's only 1,000 people in Hart. So we're getting a lot of people from the surrounding area just because there's not any access anywhere else, or they can't afford the access that's there. So I had a federal grant for the past 3 years, and on that federal grant, I had to track how many people we served from different counties. And I had predicted that we would serve people from 6 surrounding counties, and we wound up serving people from 20 counties. The small number size makes it harder to attract individuals that want to deliver care because there's not as much money to be made. I think the distance, like some of the providers that would like to come out from Lubbock or Amarillo or somewhere else, when you travel an hour and a half 2 ways, that's 2 hours tacked onto your day. So I think the distance, I think there's still some cultural things. I think a lot of rural America is either farm-based or has been farm-based, and they're pretty independent people. They just want to do for themselves. They don't want to go beg somebody else to help them. And I think that the changing demographics has contributed to the problem, because a lot of communities that used to be very low in the minority populations are now very heavy in the minority populations. We see the younger adults, we see the kids, and I've always believed that where you make your difference is if you can impact the kids. Because if I can teach a child the value of health care and the value of getting that and the value of healthy lifestyles, they're going to pass it on to their children, and it's going to help reverse that cycle.